Hello and welcome to Avenor TV. In this series, we are talking to people who are impacting lives, people who are changing communities. And today, we are in Akatsi Municipal Hospital to have a brief chat with somebody, a surgical specialist. He is a medical superintendent at the hospital here. Doctor, you are welcome.
Thank you very much.
Briefly tell us something about yourself that we may not already know by this introduction.
Okay, thank you. I'm Dr. Kofi Karikari Bonsu, surgeon specialist and also the medical superintendent of Akatsi Municipal Hospital. I graduated 2012 as a medical doctor, and I came to this facility 2014 as a medical officer. Practiced for 2 years, 2014 to 2016. Then I went back to Kolebu to specialize as a surgeon. And I came back 2019. And I've been here since as the surgeon specialist. And this year I was appointed as the medical superintendent of the facility.
What is unique about this district, and why did you decide to be here? Was it a coincidence? Was it just by the mere fact that you have to be posted somewhere, or you chose to be here?
Okay, thank you. When we completed our housemanship, when doctors complete school, you do what you call housemanship. That's you train under senior doctors for 2 years. After 2 years, then I was posted to Volta region. And the main reason why they posted us here is that you have so many doctors in Accra and then Ashanti region, Eastern region. So they want to send us to Volta region, Upper East and Upper West. Then I said, okay, it's part of Ghana. So if the Ghana Health Service thinks they want me to come here, I'll come and serve because it's part of Ghana. So that's the main reason why I came. So when I came and I practiced here, I realized that most of the conditions that I was seeing is surgical conditions. And when you refer them, some of them financial constraints, going to Kolebu, it's become a burden. Maybe it's a simple hernia, but then you have to send them to Kolebu because you can't do it. So I said, okay, then I'll go and learn how to do this operation and come back.
All right, it means when you came here early on when you were here, you realized that there are a lot of surgical cases that are coming here, and at that time you were not trained, or you did not specialize as a surgical practitioner.
Yes, that's true. So that time I can do the basic operation. For instance, cesarean section. When a pregnant woman is not able to deliver, then we take her to theater and operate and remove the baby. That was the basic I could do then. But I realized hernia people have problem with hernia, swellings on their body, abdominal conditions that need operation, fibroid and all those things. I have to send them away.
Wow. Would that mean that you, looking at things, you have tailored your career to suit the needs of the people in this community? That's powerful.
Yes, because I realized that if I go and learn the surgery and I come back, then I become a complete. So the probability of sending people away that they will not even go to the house and go and die will come down.
Wow. So you saw that the people here in the Akatsi district or municipal district may need to be referred elsewhere, and by the time they may organize themselves, organize money, even get an ambulance to transport them to where they are referring to, they may die out of the complications. So you decided to go and pursue further education so you can serve the needs of the people here. This is powerful. This is very, very inspirational. Wow. Not a lot of people think this way. Why is it your makeup Is it your upbringing that got you, or why? Is it your personality? What I want to understand why you would want to design your career to suit the needs of people in a community that you do not hail from or you are not a native of.
Yes. Thank you very much. I would say it's the God-fearing in me, because I realize that everything that I do, I should be able to say that it is complete. Because, our Lord Jesus Christ died on the cross and said, it is finished, meaning that the work was complete. So anytime I'm seeing a patient and it's not complete, you want the patient to go somewhere, they don't have money, you support them with money, they will go home. Maybe it's something that you just need to cut and remove, and the patient will be fine. And you see that your work is not complete, and the patient doesn't want to complete the work. So I said, okay, I can go and learn to make my work complete here. So when I completed my work and came here, I said, now when I'm working, if I need to do something to the end, I can do it. Wow. Because we're a surgeon. So if you're supposed to remove it, you can remove. If something you can use to use drugs, you can use it. So it make you the surgeon, your work complete.
Wow, this is very inspirational, and not all people think this way, and this is why we want to be talking to people like this, to inspire us, to let us know why they decide to do the things they do and why they've decided to impact lives of ordinary people. Now I hear a lot of stories about some of the marvelous, very miraculous things that you're doing here. I've seen videos of some of them, pictures of some of them. Can you tell us some typical cases that came and you were able to save the situation?
Okay, thank you. We have been doing so many works here. If I want to say all of them, we will not finish. But one of them I want to talk about is it just happened last week. There was this young man, about 25 years old, who had a RTA, road traffic accident. He was riding motor and he was knocked down by a car, and his abdomen hit the steer of the motor.
Wow.
And he was brought here at dawn, 12 a.m. So that was last week, Thursday. Usually Thursday, I do my elective cases. So I came at dawn to come and see those I'm going to operate that very day. So when I finished seeing them and I wrote the items for them, then I was going. But I saw this young man on bed having difficulty in breathing. So even what came to my mind was, is this man having respiratory problem or probably a COVID case? So why is he not wearing mask? So I approached him, then I realized that the man was cold. So I said, Then I asked the nurses, what has happened? So this young man had an accident at 12 a.m. and was brought here. He was fine, but all of a sudden, he started having this difficulty in breathing. And his tummy was becoming big. It was becoming white, like it was becoming pale. So, and it's cold. So I said, then he's having internal bleeding. That's what I said. So I said, I need fluid. So I set up fluid and started running. And then I called Abo for blood. And I called my lab too for blood because I know I may not get all the blood he might need. So I've called the other facilities around. So Abo was willing to bring me blood. My facility was also bringing me blood. So I set up the blood. Then I tapped his abdomen with a syringe. And I realized that there was a lot of blood coming from the abdomen. So I said, wow, then this man accident has caused internal bleeding. And you have to take him to theater immediately. Whatever the case is, we must solve what the bleeding is coming from. And because he has lost blood, he was still agitating that he doesn't want to go to theater. So I have to, within this short time, to convince the wife that is the situation. Going to operate on this man is part of reviving him. Because he's bleeding internally. I've gotten 4 units of blood I'm giving, but it will get finished. And it's like pouring water in a basket. If you don't go and close it, you die on us. Before the wife agreed and signed, and I arrived this man to theater, and was a lot of tears. The intestine has torn, was bleeding all over. And we have to even cut part of the intestine, join it, and then do so many things. and this man was discharged.
Wow.
Yes. And he came for review yesterday. When I saw him, I was very happy.
Wow, is this not miraculous? Because there's a lot of things, and this man is helping a lot of people. There's a lot of success stories that we'll be telling you here. There will be more success stories that we'll be telling you. But before then, can you tell us how was your schooling before? Can you take us back to the beginning of your journey so that we appreciate your upbringing, we appreciate the type of training you received before we come into your work proper?
All right. As my name goes, I'm a typical Ashanti. I was born and bred in Ashanti New Town with Mr. Kofi Bonsu and Madam Grace Bonsu. I'm the last born of 4 children. I attended, primary school in Ashtown, Ashanti New Town, called Konadiadom. And there, I would say I was a very serious student. So I was a school prefect then. That's class 6. I was made a school prefect. From there, I continued to State Boys, JSS. Now it's JHS. So State Boys 2, I was a school prefect in Form 2, even before I went to Form 3. Then I had a scholarship. There was a lot of estate. So I continued my education at Kumasi Anglican Senior High. And then I completed 2003. I was one of the best students. I had best in physics. So from there, everybody thought I was going to do mechanical engineering because I was the best elective math student as well. So people were saying I should do engineering. But I also realized that most often when we go to the hospitals, I see people suffering. And then you want the doctor, this doctor has gone here, this doctor has gone here. And I said, what course did they do that make them doctors? And I was told, so they do medicine. And that's okay. Then I also do medicine right from the beginning. So as they were thinking of me doing engineering, I was thinking of being a medical doctor. So I came to University of Ghana, Legon. And then our time, that's 2004. They will not let you go to medical school. You have to satisfy your grade that you had. So we call something biological science. So you have to do first year biological science and justify the grade that you had. And then you do second year biological science to justify before you go for interview in Kolebu. And by God's grace, I passed both my first year and second year in Legon. So I went for interview at University of Ghana Medical School at Kolebu. That's where I have the administrative block. So I went there and I was selected as one of the government-sponsored medical students. We are about 63 out of 400. So I had admission in the University of Ghana Medical School. That is 2006. And then I completed 2012. I was a class of 2011. But usually our course entered the following year. So I completed 2012. Then I did my housemanship at Kolebu first year, Kolebu Teaching Hospital in Accra, and then La General Hospital also in Accra. So after the housemanship, then we went for interview for Ghana High Service posting. Then I was posted here. Even when I was posted here, that time, now my wife has delivered. We were doing outdooring of my first child that I had a call from our regional director that I've been posted to Volta region. When am I coming? And I said, I'm just doing my outdooring for my child. So that was Thursday. So Monday morning, I'll be in Volta region. Actually, I was posted with 2 doctors who were Voltarians. So I quickly called them that I've been told that I'm posted with them. So when are they coming? So that at least I can go with them because I don't know the place. Then they say, they are not going. They don't want to go to Volta region.
Wow, this is interesting. I want to pause here. Voltarians are posted to Volta region, they don't want to come to Volta region because they feel that this is where they are coming from, and they think they need to go elsewhere. And this is somebody who is not from here helping develop the area. This is very important. Let's go on.
Yeah, so exactly Monday morning, I was in Ho, and I was sitting in the regional director's office, and he was shocked. He said, "Hey, you are serious? You've kept your promise." I said, "Yes, sir." And then he said, "Okay, there's a facility without a doctor. The doctor had just gone to school, and that's Akatsi District Hospital. So they will bring me here to start." I'm so, no problem. I'm willing to work. It's part of Ghana. So I came. So when I came, then they showed me where I'm going to stay. Then they told me to go and get my things ready and come. So I went back to Accra, organized myself, said bye-bye to my wife and my small boy. He was 3 months old then. I said, I'm going to Volta region. I'm going to survey the area. If things are favorable, then I'll bring them. If it's not, they can stay, and then weekends I'll come and look after them.
All right. So when you got to Akatsi, can you describe the state of the facility that you were supposed to work in? The state of the facility at that time. How was the place like, and what were your first impressions about the place?
I realized the place looks small, and the attendance too was not very impressive, and well, the people were welcoming anyway. That the management at that time, they received me well, and then they promised that they also do their best to help me stay in the district. So I also said, okay, no problem. I will do my best for the people, because to me, I don't see somebody as Voltarian. I don't see somebody in Ashanti. I don't see somebody as a Northerner. What I see that we are all human beings created by the same God, just that we have different language. And the language that you are speaking as a Voltarian is not you develop the language. It was developed by God. So if I speak Twi and you speak Ewe, we are the same blood. So the way I will serve you should be the same I will serve my people. So if I'm posted here, I should serve everybody equal. So I told myself, come to do my best for everybody to see that we are all humans. There is no difference, just that we have different languages.
That is powerful. I am sure that at the time you were in school, training, you had your career ambitions, or you had your career goals, the dream facility that you dreamt about. Every medical student will have a dream facility. I wish I could be posted here. What was that dream, and what changed? Did something change when you were posted to Akatsi?
Yes, actually I wanted to work in Kolebu as a gynecologist and obstetrician. I wanted to take care of pregnant women, and that has been my dream. And even most of my relatives, when they normally go and see gynecologists, and the money that they make from them, they will say, oh, if I become a gynecologist, I'll get money. Because if you do maybe hysterectomy, you remove somebody's uterus, or you remove fibroid, they give you plenty money. So you should be a gynecologist, especially in Kolebu, because that's where the rich patients come. But here's the case I was posted here. So when I came here, I was attached to the pregnant women. So I served the pregnant women in Akatsi here for almost 2 years. So even the district director at that time was thinking I would go and specialize as a gynecologist.
It means Akatsi actually changed the paradigm, or changed your career path. You were dreaming, or you were planning to pursue, yes, to become a gynae, but now
I'm a surgeon.
Wow.
I'm a surgeon. Because when I came, and I will say that this career as a surgeon is the best option for me. So me coming here to change the career has been one of the best events in my life. Because if I've stayed in Kolebu, I've become a gynecologist. But I when I became a surgeon, I realized that surgeon is beyond gynecology. Because some of the surgeries that we do in gynecology are subset of a general surgeon's work. So I realized that when it comes to cesarean section, I'm able to do it. When it comes to maybe a topic at that time, I'm able to do it. But when I go in and maybe somebody's intestine is rotten. I can't cut it and join it. Then I have to pack the abdomen and then be looking for a surgeon. And I want to remember that time, that was 2014, 2016. There was an RT that involved a radio presenter in town, Shine FM. And he was having internal bleeding, like what I discussed earlier on. And we were now looking for a surgeon's number in Volta region. And I was told one was at the Dome that time. And when I called Dome, I said, oh, the surgeon has gone to Accra, he's not available. So I have to sit in the ambulance myself and take the patient to 37. So when you read the 37, they operated on the guy, told the guy that the one who saved you is the one who brought you himself. And I brought the guy, I took the guy to 37, did folder, everything for the guy. Because I wanted.
And this is somebody that is not your relative. Any ordinary medical doctor will say, okay, this is it. I've referred you. Go to 37. But you accompanied the person in the ambulance and took the person and went to get the folder for the person and all that. Wow.
First, even went to Adidome to go and do scan. So when the scan indicated that his internal bleeding I'm talking about is true, then I took the guy from Adidome now straight to 37.
Now the story has changed and you can do your own surgical operations yourself. Wow.
So then I realized that if somebody gets a problem like this, which needs surgical intervention, look at what I have to go through to save this person. Then when I go back to school, I want to become a surgeon. So that when I come, most of the work I can complete it. You understand? So most of the works I do here.
Will you say the facility in the hospital here, the Akatsi Municipal Hospital, is conducive for your surgical operations?
I would say yes.
It's conducive. You have everything you need to operate.
You know, I would say it's conducive. And saying conducive means that you don't need everything before you can save life. You start from somewhere. After the basics I have to work with. Because even if you go to Kolebu, they'll tell you they don't have everything. But there are some things you need to start with. At least you have a single room as a theater. I thank God for that. If I get more, I'll appreciate.
But you use your own personal ingenuity, creativity to save lives. That is what you're doing here.
Yes. Yes, because you need a basic to save life. You don't need the whole everything. The basic that you have. So we have a theater. We have some basic surgical instruments. We have autoclave to sterilize our instruments. We have diatemy. When I say diatemy, there is something we used to cut and then stop bleeding at the same time. When I came here, then some people brought it. That they know me in Accra, they know how I operate. If they are also Voltarians, if I've come to Volta region to work, they also bring this machine. So this machine we are using is free of charge. Because they said, as I've come here to work, they are Voltarians, so they want to help me to work better in the region.
Somebody told me she had a gunshot and went elsewhere for the bullet to be removed, but they couldn't. Elsewhere, the amount they were mentioning or the amount quoted for the operation was very exorbitant. But they came to your facility, they came here, you did it very perfectly, and the rate was so low. Tell us about that story.
Yes.
Do you know
yes, I remember. There's a woman who came to me that there's something at the back that has been paining her for the past 4 years. So they were telling me the story that armed robbers attacked her. She was going to the market. So we did an X-ray and saw the bullet there. It's close to the, there's vertebrae, So I asked her, where has she been? They said, we have been going to other facilities, but because of where the bullet is, everybody's afraid to go there. So I said, okay, but what's her problem? I said, because of the chronic pain. So I said, okay, no problem. She can come, we'll prepare her for operation and see what we can do. So we did the X-ray. I look at the X-ray. I was able to localize where it is, and there was a mark also at the back. So I took her to theater after all the preparation, and then we operated, and we thank God I saw the bullet and was able to remove it.
Wow.
And you know, here the insurance works. So once you have insurance, you don't pay anything unless some of the medications that insurance doesn't cover, you want them, because we will give you the medication that insurance covers, and we give you those that insurance doesn't cover. But that woman opted for the ones that. So it's a medication that even brought the bill a little higher. But personally, the surgery did not charge her.
Okay.
So I think I review her for about a week or two. Then she's fine, so she doesn't come again.
People say elsewhere, even if you talk about Kolebu and the bigger facilities, the medical or surgeons who work there, that sometimes when you come to them, they can tell you, oh, this we can't do here, but they will refer you to their personal facilities that they can make money. But you are saying you do not charge for the operation. It is just the one
medication, the medication that she did some top up, because that medicine is not covered by insurance. You understand? Because it's at the back, and there were a lot of parts. You see, the bullet has been there for a long time, so there's a lot of fluid. We call it pus, dirty fluid around it. So when we remove, we have to put it on dialysis C. So the insurance one is a normal clindamycin, but the non-insurance one is dialysis C, which is the typical brand that we want. So she opted for that one. That's why she paid something top up. You understand? But for the surgery, I didn't charge it, because it's covered by the insurance.
I spoke to two different women who delivered. One delivered through CS in another facility, and another one delivered through CS with you. And they told me the one that did from another facility showed me the way the place has become. You could see the marks, and it's not very beautiful. But the one that did with you has a very beautiful surface, as if nothing was done. What is the magic?
Anyway, you know, we are also humans. At times, when you are making the incision, the cut, you also think about yourself. You see that the ladies, there are times they are fashionable. They want to show your stomach, bare back, and all those things. You know, they want to go to the beach. So at times, I say, okay, I will not cut you. I will make it too big. I'll make it too small, so that after everything, you can be wearing those things. You know. But somebody can also make it big so that the delivery will be easier. One doctor can do very big, because that one you can remove the baby quick. But I also struggle with the baby small, so that I can achieve a small cut that they can wear it.
So it means you are looking at the bigger picture. You are looking at the baby's comfort and health. You are also looking at the after effects on the emotions and the personality of the lady. Wow, this is different from what other people will say. That the baby needs to be well, and my work has to be easy. So let me just open it wide so I can bring the thing out quickly. Wow.
I'm also looking at after the delivery. I want the woman to presentable to the husband. You see, so that there will be no friction in the house. So I'll make a small. Please,
the men who you need to bring your woman here, because he's actually thinking about you as well. This is interesting. This is very interesting. Let's go back to another typical case that came here. You rescued the situation, and you are proud of yourself.
Yes, there have been so many cases. I remember when I was posted here, you know, I told you I came here, I went to Accra, pulled myself together and came back. When I came back, they were taking me round. You know, when they were taking me round, I reached the maternity. And when the matron was introducing me to the midwives, there was one woman on the bench screaming. But everybody focus was on me, because a new doctor has come. So they were looking at me and said, but who is this woman who is screaming on the bench. It seemed unusual to me because the woman also seeing a new doctor and still screaming there. Then there's a problem. So I told Matron that we should stop the orientation. I don't want to go around again. I want to examine this woman, why she's screaming. So I took this woman to the ward, examined her. I realized that she's pregnant, but the pain she's experiencing is too much. So here, that time we were not having an ultrasound scan. So I cannot do the scan and see what is happening. So I just did a tap. I put a syringe in the abdomen and pull it out of blood. And I said, no, it is ectopic. The way she's screaming, the pregnancy is not at the usual site. It has ruptured the tube that the pregnancy formed within it. So this woman must go to theater. So we should stop the orientation and prepare this woman. So I prepared this woman. The first day, even I've not been introduced to theater. Then I told them this woman has to be safe before I even go on.
You don't even know what is inside the theater, with the condition in which the theater is. You've not been introduced to the theater, but you saw a case and you felt that no, this has to be solved immediately.
Yes, because that has been my motive. Life is what I'm coming to save. So if there's a life to be saved, I cannot be going around showing myself to people.
It's not about pop and pageantry. It's not about...
So that is a first surprise I showed to the people here. So I took the woman to theater, and when I opened up, there was blood all over. So I stopped that bleeding. And then the people believed that, it seems that this guy has come to work. So that was the first case. Then after the operation, before they took me around, you understand? So if this case, when I sleep and I remember all this, it makes me happy. I don't see them again, but I know wherever they are, they remember that, oh, this doctor did this for me. This doctor. At times, someone come to say hello to me. I'm happy.
One of your nurses told me that you are not just a surgeon, you are not just a medical doctor, you are also a teacher. Because with you, she's able to learn a lot of things. When you are working, you teach them whilst you are working. So it's as if Akatsi Municipal Hospital is now a teaching hospital with you. And then you also teach the clients or the what's the name? People who come, the patients who come to the facility. How do you do that? And why? Where from that type of practice?
Okay, you know, I appreciate something better if I understand. If you give me instruction, do this and do that. If I understand it, I do it perfectly because I know the reason behind doing that. So at times, when I give the nurses instruction, I want this patient to be on this fluid. I want this patient to be on this medication. At times, they may say, oh, it's a normal medication they are giving. So maybe they may not even give it the exact time you want it. So you have to give them the principle behind why you want that medicine to be given and why at that time. So in the process of trying to explain to them, you have to teach them. So when you teach them, then they know that, okay, so you mean what you say or what you've written, you mean it. Because you are giving us the scientific basics of why you are giving this medicine and why I want it to be given at this time. If there's any problem, draw my attention to it because you cannot forfeit this medicine. So when I'm doing ward rounds, I try to let them know why I'm giving this medicine. And when I'm operated on the patient, I want you to monitor this patient vital signs every 1 hour or every 30 minutes. If the parameters change, inform me. And I have to explain why I want that. So that what you are doing, you also appreciate it. And also, you see, at times you may be somewhere. Maybe you have you see here, we don't close. You are working all the time. So you go and rest and something will happen. And it's the nurse who is the front line. So the nurse will take an action before we call you the doctor. You understand? So at times we also want them to appreciate the concept so that when the patient comes, they can be able to take an action and do the right thing before you, the doctor, come in. So it's a teamwork. Therefore, you shouldn't leave others behind. When you get all the team in place, you have to explain everything to everybody so that we can move on.
Wow. And you do explain or teach the patients as well?
Yes. You see, I'm giving a patient medication to go and take, to BP medicine. At times, when the patient take the medicine, there are some issue with the medicine. Because of that, they will not take it. And they won't come back to you again. So may I prefer that when they go for their medicine, they should come back to me for me to explain the side effects of every medicine they are going to take. So that if you go and experience that side, you can say, oh, the doctor told me already. So you continue. If it is worse, you come back to me. So I always tell them that the medicine, especially the BP patient, we have so many of the drugs. If this one doesn't work for you, another one will work for you. So understand that I have so many of the drugs. So this doesn't work, come back to me. And then I'll see when they go, especially the men, if they go and give them erectile dysfunction, they will not come back to you again. And the BP will be right. The next time you see them, they're having stroke. So I prefer that I educate the patient for the patient to understand why he's taking the medicine and all the side effects of the medicine. So if any problem, he will come back to you.
I know Akatsi, because of the motorbikes, the Okada business, there is a lot of cases of motor accidents and all that. How are you dealing with that? Because we hear about this on daily basis. How are you coping, and what is the situation, and what advice will you give to the youth who are riding these motorbikes?
Good. You know, it's a profession or it's business for some of them. So we cannot say totally that they should stop. But in every business, there's risk associated with it. And some of their risk is, trauma. One of them, the major one, is trauma. And I would tell them they should protect themselves. I want them to protect their head, by wearing helmet. And then they should drive carefully, because it's becoming too much. And when they have head injury from accidents, at times or most often you cannot save them. You understand? But if they protect their head with the helmet, at least you can save them, And at times too, some of the bleeding that they come with, especially from the lower limb injuries, we have to cut the leg because you cannot save that leg and they are bleeding from it. And most of them too don't want that. And if you do that, it means that it will be very difficult for them to get other job to do. So if they protect themselves, they drive safely and they wear helmet, then they can be doing their business in peace, But before I came here, now most of the trauma cases from motorbike, we send them to Juche for POP and other things, and every surgeon is a trauma specialist. When trauma occurs, you are the frontliner. So I also know how to do all these POPs. So when I came, then I brought all these POP things. So when they come, we stabilize them, we do POP for them, do everything before we refer them to orthopedic center, which can be Kolebu or Joje. So we are doing our best for them, but they should also protect themselves because it's not everything that we can do.
Somebody told me that Akatsi Hospital, because of you, Akatsi is now like a big facility. Even though the structure doesn't look like it, the facilities do not look like it, but the cases and the type of things you're doing here can be equated to what Trafalgar will be doing or what 37 will be doing. How true is that?
Well, it's not all the cases that we do here, because even within the surgery, we have subspecialties. We have neurosurgeons, we have cardiothoracic surgeons, we have orthopedic surgeons, So some of them we have to refer. Some of the medical cases we send to other facilities. But the basic that we need or the surgeon is expected to do at my level, most often I do them here.
Great. As it stands, do other facilities refer cases to you here?
Yes. I get many surgical cases from Akatsi Municipal Hospital, Adidome Hospital, at times Sogakope, Trafalgar. We've gotten some cases from Trafalgar before. When the COVID issue came, some of their staffs were having the COVID, so the theater staffs. So some of their cases, they referred to us and we handle and make sure they were fine and we send back to them. We get referral cases. If you go to the ward, most of them are from Adidome, Akatsi Municipal Hospital, because I can say this southern sector for Ghana Health Service, the only general surgeon here. Chag, they have one, but he has gone to Trafalgar now. And then Abo, which is a Chag institution, they have a surgeon who has now gone to Trafalgar, and then St. Anthony, Georgia. They also have some surgeons there, you know.
Okay. Are you receiving the necessary support, the necessary collaboration and empowerment contributions from the people themselves, the indigents of the district, the chiefs and people of the area? Are you receiving the needed support from them, and do you interact with them on regular basis?
I'll say yes. We get support. The community themselves, we have some of them who, the COVID era, they came here, gave us gloves and other things. El Shaddai gave us plastic chairs. They have been helping us. The MCE even call me all the time. Dr. Bonsu, is there any problem? What's happening? MP is my friend as well. He supports us all the time. The chiefs, even one of the chiefs, I've forgotten his name, used to be my friend, you know. He died, I think, last year or so.
Okay. The one in Tatome.
Yes.
Yeah, okay.
Yes, he used to mention my name a lot, you know. Then the media, Kanlewu, Imatek, Shine FM, Cosmos, you know, they are all my friends. I see them all the time, you know. So I get the support and encouragement, you know. That's why I'm still here. And I might also say I'm type of person who doesn't really need human per se to do my work, because I see that the work has been given to you by God. You know, it's God who brought you here. You account to God first before human. So whatever human will do, don't let it be a factor. So whether you encourage me, you discourage me, I ask myself, what I'm doing, is it pleasing my God? If it's pleasing my God, then I go ahead of it and do it. So if the patient see that I'm helping them and I see that I'm pleased with what I'm doing, then so be it.
Powerful. What is the working relationship with the administrative staff, the other support staff in the facility, the nurses, everybody? What has been the relationship? How can you describe the relationship?
The relationship is great. And even they gave me a name. I'm patient's relative, if you don't know. The patient that
everybody that is coming here, every patient, you are their relative. Okay, you are the uncle, you are their brother, you are.
So when the guys say they are looking for their relative, Dr. Bonsu, then they say, but the man doesn't come from here, so why is he your relative? Because then they say that he will understand me. So when they are coming, they come with interpreters. But I'm learning the language as well. So I have a good relationship with everybody, you know. Administrator, accountant, matron, the nurses, in charges, everybody, you know. And I don't have any issue with anybody, you know. But I get issue with staff when they don't treat a patient well. Then what they will tell you, I'll close my mind and then speak to you, but I'll go behind and then tell you because of the patient. Because this patient who came, you forgot to hand over the patient condition to a doctor. If the patient have died, what will you say? So I'll be angry when you go home and the patient is suffering. Hand over the patient. You understand? That's why the patient is my relative. So if you don't hand over the patient and the patient died, then you will not be free with me. You come and explain at our morning meeting why you did that.
I am happy you said that you are learning the language. So we'll go for some Ewe lessons now. Just give us some few lines in Ewe. Let's see.
So I know the medical Ewe.
Okay. So give us the medical Ewe. Let's.
So when the patient come, I have to work on the patient. Whistle. Okay. Patient will say yo. Then I said, Madekuku nuke warm.
Correct.
Yes, please, what is happening to you?
Correct.
I say, oh, maybe eta nadum, headache, maybe akota, chest pain, betome, sore throat, and then domadum, abdominal pain.
Wow, this is this is deep. This is deep. Wow, you know all the medical airways.
So when after the consulting room, then I'm lost. When we leave the consulting room, then I don't understand it. But the one that I need to be able to examine my patient, I know.
You are armed with everything to be able to facilitate the delivery of your work. That is so beautiful.
Yes, that is here. That's why I'm here. I'm supposed to save life. So everything that I need to save life, once I get it, I'm okay.
Wow. What will you say is the most popular? Because we need to know the demographics of the area. We need to know the makeup of this area. What will you say is the most popular, since you came here, the most popular ailment or the most popular case that keeps on coming? That you say, this is not a scientific research, but that you conclude to say that people of Akatsi South are most prone to this type of ailment. What ailment will it be?
Oh, it's our number one, malaria. They keep coming with malaria. If it's not the uncomplicated malaria, it's severe malaria. And then followed by hypertension, and then diabetes, and the road traffic accidents, and then severe strokes. And so malaria is still something we are battling with in this municipality. So
I'm concerned with the malaria bit because there are a lot of things we can do ourselves to prevent malaria. So what are we not doing right? What advice will you give to the stakeholders involved? Because I know malaria, if you have filth around us, if you have open gutters, we don't have good drainage systems, we have stagnant water, then we'll be exposed to more of this. So what advice will you give? Is there something that stakeholders are not doing, the district assembly, the communities, that they are not doing that you want to let them know about?
Everybody is doing his or her part, but the issue is that some of the people stay outside for long and they get bitten by mosquitoes before they go inside. So even if you give them mosquito nets, they will sleep in it later in the night, Some too cannot afford this mosquito spray, repellent creams and all those things. So I think we should keep on educating them.
So hold on with the education. It means what you have diagnosed or what you've seen, observed, is that most of our people, so it's a culture thing that after eating in the evening, people want to sit outside to relax, perhaps because of minimum ventilation in their rooms and all that. So I'm thinking that what it means is that you are bringing in the education bit. So and then the other one that you mentioned is the economic factor, low income status of the people here, so they cannot afford mosquito coils or repellents and all that. So what is the education? What should we be doing?
And so we have to, if there's other means that we can be giving them, as we are giving them mosquito net, we can give them repellents. Then as they stay outside, they can apply it so that we can help them. As we are helping them, how to completely help them. So if you can do that, I think it will bring the case of malaria down. because we are doing our best. We are in the curative aspect, but at times too, we need to talk about the prevention as well, because as we all know, prevention is better than cure.
I'm focusing on the malaria bit because it is preventable. It is something that we can prevent. So Aveno TV will be working on this one. Education. We'll be looking at how we can, if you're out there and you have repellents to donate to the hospital, bring the repellents so that they can distribute to patients who come here with malaria cases, so that when they go home they can use them, and then the rates of malaria cases will go down in this community. All right, so let's come back to, since you've been here, I'm sure you've brought a lot of changes to the facility, a lot of new things, a lot of new ways of doing things, and a lot of laurels as well. Can you talk to us briefly about those?
Yeah, okay. Thank you very much for this question. You know, when I came here 2019 after specialization, I realized that most of the patients, when they come, they complain about the attitude of our staff. This staff is not talking to me well, this staff is so and so and so. And I needed a platform that I can always educate the staff on how to talk to the patient. So we introduced clinical meetings. So every Wednesday morning, 7 o'clock to 8:30, we have a clinical meeting that we talk to ourselves. We educate ourselves how we are going to meet our customers. And I had done series of customer care education and programs with our staff. So I realized that the rate at which clients complain about our staff attitude has come down. You know, that's why we are not getting good name in the airwaves and also in the community. And I also realized that, you know, emergency care, very, very important because of our RTAs. So we needed to get a good emergency system to assist the emergency that come, because emergency, if you don't take it, they die quickly. So I expanded our emergency unit, and then we had an ambulance that was not functioning, donated from one of the NGOs at Dinkra. So I organized some people, we took it to Abusokai, Nakra, and then we did everything. So we have an ambulance that attends to emergency services. So if you call the national one, and maybe they said, oh, our own is not working, they have to depend on other facilities, then quickly we use our own. So our emergency system now become one of the best systems in the municipality. We attend to cases quick, and as a surgeon, emergency, you are the leader. So once everything is in place, that means that you're also doing your work well. And also we realized that the ambulance was not even having ambulance bay. At times it's parked somewhere that somebody will park behind it. When you need ambulance service for a pregnant woman to go to a different facility, then it become an issue. You call the person, come and take your car, and say, oh, I'm not here, I'm in Sokakope. You understand? So I provided an ambulance bay. You go, you will see it there. That is where our ambulance is parked. So nobody parked there. It's only for the ambulance. And then we had an X-ray container that we have been using, but most often the patient comes, they have to be standing somewhere before they access our X-ray services. And I said, no, it shouldn't be so. So I provided a waiting area, very nice for them, so that when they come, at least they can sit there and then wait and then do their X-ray and go back to the doctor for interpretation. And I also look at the pregnant women, you know, when after delivery, you know, they come for what you call postnatal. You know, the postnatal, that's the weighing services. We have a weighing shed, but the place was an eyesore. You go to the animal, sheep, the rest, they have been, you know. So I said, no, it's not nice. After they have delivered, you see, they dress well to show that they have delivered. So you should give them a place that will fit them. So I renovated the weighing shed. I tied the whole place. Even went to the ECG myself, talked to the manager. So we connected meter and everything for the place. And there's so many things we want to talk about it. You know, our oxygen delivery. Then time we used to take our cylinders to Accra. We have to go and fill it on the way. Oh, many times. No. We have other companies who can come and fill our cylinders for us. They will just bring new ones, come and take the old ones. So I checked that system. So now oxygen delivery in the hospital, hear. Then time they don't know oxygen. Now hear such a thing. So many things happening here. Through our stay here, we nursed one midwife, took her through basic training, and this year she received the best midwife of the whole of the Volta region. We have done 1-for-1 nurse too, and on the 23rd, that's next week Wednesday. Oh no, this Wednesday also going to receive the second best nurse of the region. We have so many people who also left the facility, who are also speaking about the facility, our theater. We used to have a very old autoclave, cannot serve the purpose. Now we have a very big autoclave to serve the purpose. So many interventions, our project that has been stalled for the past 5 years, we have been writing so many letters to the Director General, through our regional director, for it to kickstart, and they are all on it, So we say with a good team, I'm not doing it alone, I'm doing it with the team, management team and the staff. And we can say that Ebenezer, this is how far the Lord has brought us. We are doing our best for the people, because I see that the people are good people. They are people God has given them to us, like the 12 disciples given to Jesus Christ. So he has to make sure that he doesn't lose any of them. So we should also make sure that the community, that catching people that the Lord has given to us, we should do our best to at least say that, this case we can't do it, so we have forwarded it. This case we can do it, and we have done it. You understand? So if you want to send away, you have an ambulance. If national is not, we take our own. Emergency, everything is set. And we are doing a lot of in-service training for the staff, so that they can understand most of the basic things they do for the community. So these are the things that we are doing, all for the good service delivery.
Thank you so much for your time. I would like you to give us your summary, a concluding word. First of all, to other surgeons, other health workers, other medical practitioners, a word to them about what your experience here has taught you, and a word to the people of this community. Just give us some words.
Okay. To other medical doctors and surgeons, what I would say is that every facility that you are posted to, or any facility that you are called to work, if there are certain things that you think you don't like, or it cannot help you to work, you should go there and implement those things yourself. If you think you will need this and that, you have to go. As you work, then you help to put all those things in place. You understand? Because they may not see that you need these things for them to put it there for you to come. So you have to go, and then the others will follow. But most often they say, these people, they don't have this, they don't have that, so I won't go. As I'm speaking, I don't have an office. When I even came, I was even patching one doctor. I was a specialist doctor, I was a medical doctor, but I was patching him. And they were even shy that how can a specialist patch me? They are thinking I'm coming for a big mansion before I can stay in. But it's not so. At the end of the day, am I saving lives? Yes. And that is what we are being called.
No, but this is interesting, because this is the medical superintendent of this facility. He doesn't have an office. Elsewhere, a superintendent will pack somebody from his office and say, yes, I'm taking over this place. Why haven't you I'm sure there are some rooms in which there are certain people occupying and working. They are also working, but elsewhere somebody will get a shade for them somewhere, or create a corner for them somewhere and take over the office. It looks like you don't like your comfort.
I always give you a biblical example. You see, Jesus Christ, he created the world, but when he came, he was not having a place to sleep. By the end of the day, his work was completed. You understand? I don't have an office, but it is not the doing with anybody. It's because of the structure. Akatsi Municipal Hospital, we don't have administrative block. So I've initiated it. You understand? So when we complete our administrative block, I'll get an office within it. You understand? For the meantime, I sit down with the administrator.
You have a consulting room where you do your consultations and all that?
Yes, we all share the consulting room. I don't have a dedicated consulting room that this is for medical superintendent alone. No. If Tuesdays I do my consultation, so I take consulting room 1. Wednesday, a different doctor will take consulting room 1. Even if Tuesday I don't go early, by the time I go, another doctor is taking consulting room 1. So there's no consulting room which is for a particular doctor. No, we all share.
Okay.
Yes. So that we don't bring like inferiority complex within anybody. We are all saving lives.
My name is Prosper Ekwamo. I'm a general nurse in the mill ward. I'm the mill ward in charge right now. Dr. Bonsu is our medical superintendent currently. He was here earlier, went to specialize, came back, and now our medical superintendent. Very hardworking, both day and night. Call him anytime. Dr. Bonsu will be here. He teaches us a lot too as nurses during rounds, during the ward. Even he can come and sit in with us at the ward, interact with us very well, teach us. He's a friend. Basically, he acts as a friend, even though he's our head. He acts as a friend. He sometimes even helps patients, those who are unable to pay bill. He tries to find ways of getting them out of the hospital to go home. He conducts surgeries. Sometimes those who cannot even afford, he will do it for them. And he's always hardworking. There are lots I can say. I can't just say everything. He's an embodiment of everyone, every leader, everyone will wish for. Since he came, a lot of changes has happened in this hospital, both physically and structurally. A lot of things have changed. We are so happy that he's here. Actually, very for me personally, I am very, very happy he's here. Aside work, personal relationship, you go to him, he will help you out. He will hear you out and help you. That's the little I can say about Dr. Bonsu.
I am Emmanuel Suewa, and I'm a nurse here at Akatsi South Municipal Hospital. And Dr. Bonsu is the medical superintendent here. And actually, if you ask me about Dr. Bonsu, there are a lot of things I can tell you about Dr. Bonsu. Actually, he's a good person, very affable, very competent, and he's one of a kind that he likes teaching. Actually, if I want to talk about Dr. Bonsu, Akatsi, the state of Akatsi Municipal Hospital now, since Dr. Bonsu came here, he has really raised the status bar. So he's one of a kind. He's very good. He's very good, and I'll recommend him on any day to anybody. He's very good, very good. And when it comes to personal relationship, he's the best. He's the best. Dr. Bonsu is very good. Actually, that is what I can say. He's very good, very keen to his work. He doesn't absent himself. Always busy at work. Even when there's pressure, you see Dr. Bonsu. Anywhere there's any issue or whenever he's needed at any time, you find Dr. Bonsu there. He's very good. Actually, Akatsi Hospital is not so much resourced for certain complicated procedures. But when you look at the kind of procedures and the kind of let me say operations that Dr. Bonsu does here, you will be marveled. Especially when it comes to amputation, we are not so much resourced. But Dr. Bonsu has managed to find a way to do his procedures, those within his means. He does it perfectly, and the ones that is above him, he refers as early as possible to avoid subsequent complications. So Dr. Bonsu, when I want to talk about Dr. Bonsu, he's one of a kind. He's very good. Yeah.
I'm Dora Frimpong, the OPD in charge here. Yes, I've worked with Dr. Bonsu for close to 8 years. We were in the ward and later we both left for school and came here. Dr. Bonsu is very submissive. So though he's a medical soup, he doesn't do anything to hurt anyone. Yes, he teaches a lot. When you don't understand anything, when you go to him, he will teach you. And at OPD, he can come anytime, even if he's not on duty. Patients are there, and he will help us to clear all the patients from there. Yes, Dr. Bonsu is very submissive. And theater, I've not worked at theater before, but I know that he's very good in what he does.
My name is Ebenezer Kwesi Wajoli. I'm a staff at the emergency unit. I've been around for quite 4 years now. Working with Dr. Bonsu has been one of the best things that has ever happened to me. Considering my 4 years stay here, being a union leader, I've worked closely with members of management. But when he came in as the new medical soup, he promptly addressed any issue we come up with as a union. And then his attitude towards work, anytime you call him, he's available. He will never to tell you I'm busy or I'm doing that. Working with him gives you some kind of passion, energy. We do a lot of stuff. At times we complain about lack of motivation, compensation for things we do outside our scope of work. But seeing him work, the sacrifices he puts in, gives us the motivation to work more, even though we don't really get a needed motivation we need to do. So his passion for work is excellent. It's just that we don't have the needed tools we need to work. He's a surgeon. He does a lot of cases, and after the surgery as a unit, we need to monitor those cases. We need a cardiac monitor, of which we don't have. So I would just appeal to anyone listening to us that they should come to our aid to help us do our work in a much more efficient way. Thank you.
Thank you too. Ukonyenya jifato juro Dr. Bonsu anya klimu wo docho 2012 has mova. Anya America fianu ama. Na masana na gomo ye na tedanwa afia kadodo nua da le mia do viu pla Dr. Bonsu go agomenya ba have assistant e manya nu gade mi nya no kaka no va at least afia nu mi afia ale kako adoye tuzu na wo ojaji ne afia ga na dono ho va koja achona dalama abia na la gbagba na amada va e na gahama la shiwa akpana dan na mo poga na wo doyi ka wa ba mara henya la ngunyi chova ikaba gama la shiwa ala gbagba adoma na mo wo dona mo atanku kaka ati ata paranchi o haya ojo ya fama ikatanya ni ka ajajina mi katata kadodo nyila mi kata mi ado anya mai ka wo do sasa akpanara ma wo na do adu da di mata akpe kaka.
Very thought-provoking. This has been very powerful, inspirational, and I know that you've learned something from this powerful personality that is impacting lives, that is changing lives, that is giving life to people. We appreciate his work, and if you are somewhere thinking about how you can help support the facility, I am sure the doors are open. Anything you have to donate, if you are native of this community and you have something to donate, you have any appreciation to give to people who are helping your relatives who are living here, people who are helping the old ladies here, bring those donations to them. it will be very much appreciated. This has been Aveno TV, and you've just watched Personality Profile. Thank you very much.